Okay, we will go ahead and get started. Good afternoon and welcome everyone to the IQMax Meaningful Use webinar. I'm Chris Vaqueros, Vice President of Sales and Marketing for IQMax. And in today's presentation, we'll provide you with an overview of the IQMax Connected Healthcare Platform and where we see the intersections of the IQMax solutions and meaningful use. But before we get started today, I'd also like to introduce Heath Long, our product manager here at IQMax. Heath will be providing us with his insight into how the IQMax solutions can support and enhance your meaningful use strategies. Just a note that we'll have the lines muted today during the presentation. If you have any questions, please use the chat feature to submit those questions, and we'll get to answering those questions at the end of the presentation. So to begin, I'd like to provide you with a brief overview of the IQMax Connected Healthcare Platform. It's comprised of three main segments: enterprise interoperability, decision support tools, and enterprise communications platform. On the enterprise interoperability, this is where IQMax provides the ability to pull in various pieces of data and manage those connections with our IQ Connect interface engine. The data is then normalized and presented real-time at the point of care or anywhere that the data is needed. The decision support tools is the IQMax application suite, which consists of IQ Rounds, IQ Charge, and IQ Speak, providing clinicians with tools to streamline their daily workload and receive critical alerts and the ability to accurately review and capture patient information. Lastly, on the enterprise communication platform, this enables secure, real-time communications between colleagues and care teams. And IQ Communicate also provides the ability to include patient information within messages to allow for a more meaningful conversation. The platform provides true integration and information exchange essential to coordinated care. Now I'll turn the presentation over to Heath, who will walk us through how the IQMax solution can bring specific value to your meaningful use strategies. Heath?
Okay, thanks, Chris. Thanks for the introduction, and thanks to everyone, all of the attendees for attending today's webinar. I'd like to take a few minutes to introduce you to our IQMax product line and shine some light on how our platform and applications will assist you in achieving meaningful use. Healthcare providers and facilities are inundated with data and reporting challenges related to meaningful use. In this and past webinars, we've identified some of these challenges related to real-time data collection at the point of care, data in disparate systems and housed in multiple locations, the evolving and dynamically changing requirements for meaningful use from stage to stage, and meaningful use's impacts on care coordination and efficiencies in clinical workflow. As Chris mentioned earlier, our platform consists of three main pieces: interoperability to provide meaningful information to stakeholders and connect disparate systems, decision support tools for better decisions and data collection at the point of care, unified communications to stay connected and share critical information with the care team. And each of these pieces brings value to an organization that's struggling with meaningful use compliance. So first, let's take a look at interoperability. Our IQ Connect and IQ Exchange products provide powerful tools for aggregating data from any source, analytical reporting, business intelligence, and decision support, and for sharing data amongst various systems. The benefits of interoperability specifically related to meaningful use. While the EHR is the primary reporting tool for meaningful use, we need to keep in mind that the data elements, required to accurately report meaningful use compliance are generally housed in multiple systems. Our interoperability products complement the host reporting system by facilitating the exchange of critical information amongst these systems, meeting the expanded requirements for feeding specific and non-specific registries, such as immunization and cancer registries specified in Stage 2, and exchanging and receiving data in a structured format, as well as integrating the electronic health record with health information exchanges and clinical data repositories. As meaningful use requirements expand from stage to stage, so do the population and reporting metrics required to achieve meaningful user status. While in most cases the EHR provides the tools necessary to record and report meaningful use data, that data still needs to find its way into the system. And this is where our decision support tools play a vital role in meaningful use compliance. By providing easy-to-use tools at the point of care for e-prescribing, integrating real-time formulary and medication checks at the point of care, as well as medication reconciliation, mobile physician order entry, the capability to view imaging results on the device, as well as clinical decision support tools at the point of care on a device that the user is already comfortable and familiar with. You're going to greatly see an increase in the quantity and accuracy of data collected, which will greatly help you facilitate those meaningful use metrics. Our enterprise communications platform is a powerful and patient-centric collaboration platform that provides text messaging and alerts, instant voice, integration with connected medical devices in a telemedicine spectrum, and integration points with the existing premise PBX and user management tools, such as Active Directory for contacts and things of that nature. The point-of-care communications application, specifically IQCommunicate, includes point-of-care clinical alerts and notifications, the capability to share and view patient demographic and clinical information within the context of a conversation, integrated voice capabilities with both the native device and the premise PBX system, as well as connecting mobile medical devices and providing patient portals that facilitate patient and family engagement as required in the proposed stage two rule for meaningful use. IQCommunicate's benefits, as they're directly related to meaningful use, impacts requirements related to care coordination and patient engagement. Facilitating care coordination and communication by providing point-of-care alerts, increasing quality of care and positive outcomes, real-time care team collaboration, and all of this in a secure and intuitive communication interface. Engaging patients and families by connecting their connected medical devices, providing interactive patient portals as specified in the proposed Stage 2 rule, as well as other Stage 2 metrics for things like discharge summaries, delivery of patient education, and care plan and visit summaries, and also sending follow-up care messages and reminders. So as we can see from some of the feature set, our IQMax Connected Care product line really does provide real solutions for meaningful use. Interoperability tools that give your organization the capability to exchange information in a meaningful way. Workflow tools that enable you to capture critical data elements at the point of care with minimal impact on existing clinical workflow. That's a very key and important element. And secure communication tools for care coordination and patient engagement. So with that, I'd like to turn the session back over to Chris for a few moments. Chris?
Great. Thanks, Heath. That was a very good summary provided. Now what I'd like to do at this point is check and see that if we had any questions submitted from the group before we wrap up the presentation. Heath, have we seen any questions come in from the group?
Let me check, Chris. Yeah, we do have a couple. First one off is a question for you, Chris. Have we integrated with existing EHRs?
Yes, we have. IQMax over its history has integrated with just about every possible system out there, from Cerner to Epic, McKesson, and so on. So we've integrated with a lot of various clinical EHR, EMR systems out there. Additionally, one thing to note that we didn't address in the presentation is from a mobile support perspective, in terms of the operating system, we do support Apple iOS, Android, Windows, as well as RIM BlackBerry.
Okay, great. All right, let's see. We have a question here. So does mobile demonstrate real time savings to the user, or does it just help me get information in and then I have to do more work and documentation down the road? Yes, it does demonstrate a time savings to the user. It takes away a lot of the later work because you're really real-time collecting information. For example, in the act of writing a prescription, you're collecting the data to do the script, you're comparing that to the formulary requirements, also doing your medication reconciliation, it's checking for potential interactions, and then potentially, depending on the integration level with the EHR, it's also updating the active medication list in real time at once. So it goes back to the old saying, killing two birds with one stone. So you're really doing a lot of things at one swipe at the point of care. And let's see. We have a question regarding specific impacts. What specific impacts does mobility have for the priority to improve care coordination and meaningful use? And that's a very good question. So based upon the proposals for stage 2, the stage 2 proposed requirements for improved care coordination, that centers a lot around medication reconciliation, transitions of care. And so there are a couple ways to attack that. First would be through integrating that EMR, or the electronic medication administration record, and putting that application on the mobile device. So that directly impacts medication reconciliation at the point of care. And then secondly, there's an immediate impact for implementing mobile communications tools that assist in collaboration, formulating and providing things like the summary of care record and care transitions as patients are transitioned throughout the care environment. Let's see. Do have a couple questions regarding if the slides are going to be available. We can make those available at the end of the presentation if you want to contact Chris or our sales team as well. So we can make those available.
Heath, do we have any more questions?
I believe that is all, Chris.
Okay, great. So before we conclude, I would like to note that we are having a drawing for a few iPads for those of you who would like to see a demo and discuss further how IQMax solutions can help your organization. Also, as an additional incentive, we are offering a free 3-month pilot period for qualifying customers. So those of you, please feel free, if you have any questions, to contact us at sales@IQMax. Or give us a ring. Additionally, you can follow us on Twitter at IQMax Mobility #MUMHealth. And that concludes our webinar for today. And we thank each one of you for attending the session, and hope to hear from you soon. Thank you. Bye-bye.